Big round of applause for Dr. Patel. United States famous, Dr. Patel. He has performed all over the United States. He is currently, he's performed all over Atlanta. He performs at the Laughing Skull. I'm his bodyguard in case any women start to talk about this. So we are so thankful. Happy Nurses Week to all my nurses. Thank you for the patients that have come. We enjoy the fact that you're here with us today to celebrate Nurses Week. This is the start of Nurses Week, so if you see a nurse, give them a hug. And we thank all of our interdisciplinary community club people for coming today. This is our grateful word of the quarter. So this is the interdisciplinary community club. We have an international luncheon on Wednesday. Everybody's invited to that. It's going to be part of our park cultural piece of what we're doing for park. So the ticket to get into this room on Wednesday is to bring something from your hometown. Okay? It's going to be a great week. We enjoy everybody being here and get it.
All right, thank you everybody. Can you all hear me okay?
Yes.
All right, excellent, excellent. So yeah, I'm really honored to be a part of this. I'm honored that Debbie asked me to open up Nurses Week because I really appreciate everything that you all nurses do. My job doesn't make sense without you all. It's just clicking on a screen. You're the one who takes our orders into action and actually change the patients' lives. So I'm really happy to be doing this. That said, the computer isn't as happy. It has technical difficulties, so you'll see the videos, the usual, right? So this is, I walked in the hospital and I saw this flyer posted all around. So the hyperbole, that's Debbie's, best comedian in the world. My own mom, she said that it should be best comedian in the ward. I was like, Mom, I'm the only comedian in the ward. It's not much of a compliment. She says she thinks highly of me, but... So I should tell you, when I was writing the jokes, the initial responses were kind of mixed, or you can see Linda's reaction right there. All three of them, somewhat disapproving. I told him this joke. I said that, nurses, you all get a week, but we doctors, we only get doctor's day. What's up with that, right? I think in the past, we tried to take a week, but we kept getting paid by nurses. Yeah, that was the reaction to that. But they forgave me. Or as Jenny says, do we have to pretend we like you now and smile? I've been here almost a year, and I definitely have formed some relationships, and I learned a lot of early lessons from this beautiful nurse right here, Regina. One of my early lessons was when we were discharging a patient with condom catheters, and I wasn't sure. We needed to give him 1 month supply. I just wasn't sure how many to discharge the patient with. I asked her, how many times can you reuse a condom catheter? So, fair question. So she asked me, how many times can you reuse a condom? I said, I don't know. I skipped that class in med school. Is it twice? Flip it inside out? So, I am not the best nurse. That's why you have much better nurses than me. So again, I really appreciate the family feel of this place. It's small enough that you get to know everybody. Looking in the audience, I see people I've treated patients with, taking call. We've done, saved some disasters and really felt good about it at the end of the day. Every time I walk by this desk, somebody asks me to breakdance, Like, it's a hospital, So for those of you who weren't there at the holiday party, I actually have the video from the breakdancing. So this is one of the technical difficulties, it's playing sideways. If anybody knows how to fix that, speak up, but otherwise we're watching it sideways. And do we have volume?
Somebody in here will volunteer to sing.
Oh, because we'll need the volume for the later videos.
There we go.
No volume though.
Alright, hang on.
Alright.
Guys, while they're
I'm not
fixing
part
the
of
volume, you'll notice a big basin up here at the front. This is to pay for his medical school loan.
I don't think that'll make a dent, you know.
See if you got volume now. I don't know.
So, I should warn you, the second take wasn't quite as impressive. You had a little hitch. So here's round two. I kind of went off the stage a little bit and almost kicked some lady in the head. I don't think she works here anymore. She was traumatized. Yeah. I can hear one of the select administrators saying, "Potential admission, TBI."
Could be Tom.
But you know, on those days with 10 admissions, it's you all who actually I rely on to nurse me back to health. You know, here's Taylor doing it. Next time there's 10 admissions, I say just let me pass. It'll be less suffering that way. You know. So, all right. So a few more things. So you know, as Debbie was advertising this event, she was saying to certain people that I was their best doctor or their favorite doctor. I don't know about that, maybe. All I can say is that patients like me a lot after I prescribe them oxycodone. So I'm just kidding. I don't get them to like me by prescribing oxycodone. I use hydrocodone. So I've been getting calls late at night. And, around 2 a.m., I don't know who it is that calls me. I just have no idea. But they say, "Dr. Patel, how are you?" With a long pause. I'm like, internally I'm thinking in my head, it's 2 a.m. How do you think I am? I'm tired. I'm not looking to start a conversation here. So. And then lately, they also have been calling me, and my response is usually, "Oh, can this wait till the morning? It's like 4 a.m. And they're like, "Dr. Patel, it's not 4 a.m. It's like 10 p.m. Why are you in your bed already?" That's another thing is that, I've met, it seems like every patient knows a Dr. Patel who took care of them. I'm not related, I promise. I am not related. But the good thing is that those Dr. Patels, they're almost always good doctors. They're good doctors. So, I don't mind that association. I actually like the last name Patel. It'd be much worse if I had the last name Tripp. every time someone mentions that doctor, something bad happens. Somebody fell or something, you know? I don't know what it is. He brings bad juju. You know? All right. So I'm gonna perform a little bit of the jokes that I do around here in Atlanta. Any of you are welcome to see me anytime. And then I'm gonna get back to some videos, some nice patient testimonials, and back to Nurses Week. So on with it. So girls like Brad Pitt, right, ladies? Yeah. So I used to stare at photos of Brad Pitt, thinking that my cells would organize so that I look like him too. But then I realized if this were true, there'd be a lot more girls in the world who look like Brad Pitt. So I'm actually from West Virginia, and I should warn you, not everybody there looks like me. Yeah, the Indian subgroup is being heavily overrepresented right now. Basically, since I left West Virginia to Atlanta, West Virginia's been like, where'd all our Indian go? I went to a high school of 1,000 people, but only 2 Indians, including me. The other was my little sister. You know, when I was in med school there, I was actually treating a patient, and I told him, I was like, wow, you have a really rare condition, which I've never seen before. And he's like, arthritis? I said, no, being African American. We actually have a saying in West Virginia. It goes like this, you know, love is a feeling that occasionally happens between a husband and a wife, and frequently happens between a brother and a sister.
West Virginia.
You know, a lot of people tend to focus on the negatives rather than the positives about West Virginia. So I'm going to do the exact opposite. For instance, did you know that 1 out of 10 people in West Virginia are not morbidly obese? Well, one more joke about my state. So a lot of diseases that affect humans, you know, actually started out in animals, like swine flu, bird flu, mad cow. You know, I don't know what disease the baboon has with his giant pink buttocks, but I think he's infected a lot of people in West Virginia. All right. So I'm Indian. I'm Hindu actually, and the hardest thing about being Hindu is that we have 3 million gods. Yeah. I don't even know all their names. You know? Yes. Today I stove my thumb. I was like, oh, did I take the Lord's name in vain? I don't know. I was actually working on a math problem, and I accidentally summoned like 3 of them, you know? They're like, hello, it is Shiva, Durga, how may we help you? I said, geez, I just wanted a hen, not 1,000. But while you're here, you might as well help me with this math problem. So they go, well, we made you Asian, so we've already helped you with that math problem. So there's a study that shows that breakfast is not the most important meal of the day. I'm kind of skeptical, though, because the money used to fund that study, apparently it came from a fundraising dinner. So let's see, there's these Italian doctors who invented this brain-shaking device. Yeah, it shakes the brain to find out how much activity is occurring in brain-injured patients. You know, people in coma, vegetative state, and shaken babies. I'm like, what? Shaken babies? Isn't that what caused their problem in the first place? What were those Italian doctors thinking? Oh, let's shake the baby's brain. He has any brains left. Oh, he does. He did. Shoot. Yeah, right. I wonder how they would diagnose diabetes, you know? Let's feed them a bucket of pasta. Right? So, So I was driving around and I saw this hospital that was completely surrounded by cemeteries. Yeah. What kind of message does that send? We learn from our mistakes. But we do make a lot of them. So, nothing says we're a teaching hospital like having a cemetery out front, right? Yeah, so one thing we tend to do is we do Botox, to help patients. But apparently there's counterfeit Botox, which looks exactly like the real stuff, but it's made in China and has like no regulations. Yeah. So not only does it remove wrinkles, but it also removes all sincere thoughts, feelings, and emotions. Yeah. So basically, in rich, snooty white women, it's a pretty good counterfeit. So there's one innovative treatment some of you heard of called maggot therapy. The studies show that actually maggots clean out your cuts and wounds as effective as a surgeon. Yeah, pretty crazy. It eats all the dead tissue and leaves the living tissue alone. So I just wonder how you sell that to a patient, right? I mean, the surgeon could be like, well, we could have me, the anesthesiologist, the nurse, over 50 years of medical education, drugs, modern medicine. Or you could throw some maggots on it a couple times a week, See how that does. What patient is going to say, I want to try the maggots? Okay, so, one benefit about being a doctor is that we can treat ourselves, even though we're not supposed to, But we can listen to our heart, take our blood pressure. But what about the prostate exam? I have never had the urge, And the alternative isn't that attractive either. Some other guy? No. Right? So, right? So, I don't know. Some doctors say, not me, say that, the rectal exam, the digital rectal exam is how you get back at disagreeable patients. They call it giving them the finger. So, it's a good thing that surgery is voluntary, because otherwise it would make for a pretty good threat, Like, I'm going to shove a tube down your throat, cut you, and leave you so you can't crap for days, right? It's terrifying, right? I wouldn't want it. Yeah. So, general surgery, it does cause ileus, the really bad constipation. It's a known complication. It's just general surgeons, what they do, they constipate things, right? I was standing in line at the cafeteria. It was a really long line, and I look a few people in front of me, and there was my friend, the general surgeon. I was like, no wonder this line's all backed up, General surgeon standing in it, right? So, did I mention that I love surgery? No? Oh, good, because I don't. All right. And so, if you ever reveal the intimate details of a marsh, it's called a hippo violation. That'd be you like that. That'd be on your board. All right. So another true study. So there was a study that showed that having intercourse with farm animals increases the risk of cancer. Why would you do that study, Yeah. Is there somebody who's reading it who's saying, well, I was considering, having intercourse with farm animals, but not anymore. Right? No. What if the study showed that it decreased the risk of cancer? Would it be doctor recommended? Let's do 4 cycles of radiation, chemotherapy, and make love with 4 donkeys. So they say a picture is worth 1,000 words. A nude picture, however, is worth $1,000. You know, my high school Spanish comes in really handy in Mexican restaurants. Like, for instance, last week, I knew immediately that salsa verde means very good salsa. I studied hard. You know, what's the deal with the spelling bee, right? It's the 21st century, and we have spell check now. How does that thing still exist, right? Saying you're good at the spelling bee is a lot like saying you're good at the typewriter, right? It's useless, right? See, I'm especially critical because I had one of those parents who made me study for the spelling bee, you know, yeah. And I actually won, so in 6th grade. You know. My mom told me that I should win the spelling bee to put on my resume. I was like, Mom, there is no job you need in order to get. In fact, the spelling bee champions are all being outsourced to India. I went to my family reunion this summer. The last 10 winners were in attendance. You know? my one cousin, Rajendra Kumar Lalit Chandra Mahesh, he actually won the most recent spelling bee for correctly spelling his own name. You know, I wonder why is a spelling bee on ESPN? You know, those kids, they don't look like athletes. Their pants are up to here, the thick glasses. Man, if those kids are athletes, then so is my grandfather, who has athlete's foot. All right. So, you know, I went to the Museum of High Art here in Atlanta, and there I learned that if you're good, you're considered an artist. But if you're not, you're considered a modern artist. The bathrooms are also on the modern art floor. You know, no coincidence. So let's see. So God made nudists, but unfortunately, He made them all out of hippies, right? Why are all these young people? So I was wondering, what is the difference between a model and a supermodel? I think supermodels have superpowers. You see, a model can throw up on a full stomach, and a supermodel can throw up on an empty one. So, on a serious note, we can't rewrite our pasts, just our autobiographies. Mine says that my current girlfriend was always female. So, you know, it's got a lot warmer now, but man, for a long time, it was cold. It was really cold. And what I learned is that women are much better designed for the cold than are men. Because when women get cold, they get sexier. It's like, ladies, deploy your nipples. Whereas for men, it's like, retreat! It happens. So somebody told me that you should always question authority. And then I learned that person was an authority. So I was like, why should I listen to you, Eric Gerard? All right. So my Chinese friends are all very good students who never fall asleep in class. I'm like, what a poor use of Asian eyes, you know? That's like their main function. Hey, they tease me about that. I would totally take it. I fall asleep in class a lot, yeah. So let's see. So attractive girls are often high maintenance, which sounds expensive, you know. My way around this is to take a nice homely girl and give her lots of plastic surgery and then marry her. That way all my costs are up front. No maintenance. Yeah. So Dogs are kind of weird because they sniff each other's butts. It's a good way to pass disease because when one dog gets diarrhea, the other gets a runny nose. So you saw my breakdance video, and I learned to do all those flips because I take gymnastics. And the weird thing about that is that everyone else in the class is a girl less than 10 years old. Yeah. My leotard looks totally inappropriate. I actually asked the teacher, "Do you have an adult class?" And she was like, "No adults take gymnastics, except you, and we are so glad to have you." She actually told me that next week she's bringing a celebrity to the class. I'm just worried that that celebrity is going to be Chris Hansen from To Catch a Predator, Dateline NBC. So, the other hard thing is that everyone else in that class is way better than me. Especially Stephanie. Man, she always gets the gold star. She's only good because her dad's the coach. You see, I'm so glad that hanging around 10-year-old girls hasn't rubbed off at all. All right, so I just want to get back to some of these. So I shot some testimonial videos. You may recognize this one right here in the front row. Yeah, and so okay, let me turn up the volume. And these were not; these were randomly chosen. So
I'd like to thank you, Dr. Patel, and your entire staff for such a wonderful job. Your nurses has been excellent. If they weren't, you would know about it because I would tell Wendy, and Wendy would jump all over them. But so far, they have been wonderful, and thank you so much. Plus the fact, all your nurses are nice-looking ladies, because I don't like ugly people. They make you sick, They're mad because they're ugly. So they will make you be angry too. And I'm not an angry person. I'm a very happy person. And I'm so thankful for being here, and I'm thankful for my family, my sons, my daughter, and everything has just been wonderful. And
Happy Nurses Day.
Happy Nurses Day to all of you wonderful nurses, and keep up the good work, okay? You must have a passion for this job because I know it's not easy, but you are doing a wonderful job, and thank you so much.
Dr. Freed, he says that they're good. They're just good. When they come on, they come on time. They address all the things. They're good company, and they're good. He is married to a nurse, so I think he had better say that.
So nice when they come. Like I say, I don't know what I would be that nice, but they are so nice, and they respond nicely, and they respond so nicely, and makes you feel that company. It feels you like company, and they're good. They're good. That's all I can say is they're good.
All right, and then here's Mr. Dubner.
Hi, this is Jerry Dubner, and I've been at the Emory Rehab Center for a little over a week now, and the highlight of my stay here has been the interaction with the nurses. They have, without exception, done a wonderful job in taking care of any of my needs, and I've also noticed that they take care of the other patients' needs, and they couldn't be surpassed in their excellence in performing their duties and the attitude that they have in doing so. I am very fortunate to be in a situation where the nursing staff is as good as it is.
Wonderful. And here's Mr. Madden. Again, it's because of busy video cutting area. He loves you all. But to summarize, he's an entertainer. And commonly in his profession, they tell him, break a leg. So he said he loves to play so much, he'll be back.
Oh, in regards to nursing appreciation, as I told several of these nurses, I am an entertainer, but there's an old saying, "Go break a leg, so I'll be back."
All right, and I just want to play these two because I'm so deeply grateful. Like our profession doesn't make sense without nursing. We're an incredible team, and I feel like you do most of the effort. But don't take my word for it. I want you to hear from some actual nurses, and these stories really touched me. So.
Performing an original monologue, here is Kelly Johnson, Miss Colorado.
Every nurse has a patient that reminds them why they became a nurse in the first place. Mine was Joe. Joe was in the beginning stages of Alzheimer's. He had moments with and moments without his memory. But the hardest part about the aging condition for Joe were his night terrors. He would wake up in the middle of the night screaming absolute bloody murder. But if I just went in there and held his hand for a few moments, I could usually get him to calm down. But then he wanted to talk. He would ask me if I could change his treatments, and I'd say, "No, Joe, I can't. I'm just a nurse." "Well, what about my medications? Can you fix those?" And I'd say, "No, Joe, I can't. I'm just a nurse." But because I couldn't do those things for Joe, we connected on other levels. He would ask me about volleyball. We would talk about his grandbabies. And he would tease me about being the only nurse on the unit that can reach the gauze on the top shelf. It was a lot of laughs with Joe. But then one night, everything changed. I found him in his room crying. And I went over to him and I lifted his head up out of his hands and I said, "Joe, I know that this is really hard, but you are not defined by this disease. You are not just Alzheimer's. You are still Joe." And he looked right back at me, almost to look through me, and said, "Nurse Kelly, then the same goes for you. Although you say it all the time, you are not just a nurse. You are my nurse, and you have changed my life because you have cared about me." And that's when it hit me. Patients are people with family and friends, and I don't want to be a nurse that ever pretends, because you are not a room number and a diagnosis when you're in the hospital. You're a person, very first. And Joe reminded me that day that I'm a lifesaver. I'm never going to be just a nurse.
Miss Colorado.
All right, and then I don't know if any of you have seen this video before, but this is actually a patient who was paralyzed, and she came back to the rehab hospital specifically to meet her nurse, who she bonded with at the hospital.
You know, I'm stuck on the elevator.
I heard. She's waiting for you right there because she was waiting for you.
Thank you for looking for me. See that?
Goodness, look at you.
Yes, thank you, Lord. Thank you. Oh my God.
Look, I'm the one crying. Where'd you go?
Oh my God. Thank you, Lord. Thank you. Oh, Jesus. Thank you. Thank you. Thank you. Oh, I've been praying for you. Oh, Lord have mercy. Oh, man. When did it happen? Thank you.
Wow, look at that.
Thank you. Oh, baby. Thank you.
Told you that would make her day better.
Thank you. Oh, Lord have mercy. Oh, I'm so happy for you. I'm so
See, now don't you forget about being in the elevator.
I know she forgot all
So
about that.
where did you get out from, though?
Oh,
We were hoping this was going to make you forget about the elevator.
Yes.
That's why she was waiting for you at the elevator.
yes. I came in front. I wouldn't catch the
And look, and what did I just say? I said,
I'm so happy.
look,
for
I
you,
just said,
baby.
if she's on 6th floor, she's going to come
Thank you,
fix
Lord. See there, I told you. Just keep that faith.
Remember, we were discussing, we were talking about it.
Just the other day I told her.
Yes, that's
Miracles
good,
still
sweetie.
happen,
That's
you know.
good. That is
So, and that shows you just like the potential of connection that you all have with your patients. You know, a pill can't show love or affection, and you all can do that. But beyond leaps and bounds. So thank you, Debbie, again for inviting me to here to open up.